So we know that labour typically starts somewhere between 37 and 42 weeks. So we have this lovely 5-week window where babies may make their arrival. And if we look at the stats tell us that most babies, particularly on a first pregnancy, are more likely to arrive somewhere between week 40 and 41. The average gestation is around 40 plus 5, in fact. So it is very likely that your baby may go past their due date, but it's important to understand what the early signs of labour are so you can look out for them. So one of the first ones that women tend to notice is something called the mucus plug. So the mucus plug is a little plug that sits inside the neck of the cervix, preventing any infection passing through to your baby. When labour is starting to progress, so when the hormones start doing what they're doing, so particularly prostaglandins soften the cervix out as labour is starting to begin. When the prostaglandins start to soften the cervix, the plug can't be held in place anymore, so it releases. Sometimes that can happen in little bits throughout the course of the day. Sometimes it can come away in one big lump. It looks a bit like snot. It can be blood tinged. And sometimes women notice that the plug is falls out if they've had a sweep. Sometimes sex can actually cause the plug to come out. So if that does happen, it can actually regrow. So if you've had a sweep and you notice your mucus plug has gone, it might just be that the plug has done that, not the sweep has done that, not necessarily you've lost your plug. So that's one of our first ones, the mucus plug. It doesn't mean that labour's imminent if you do notice it. It just means that it's a really good sign that things are starting to happen. The prostaglandins are starting to do their job and soften the cervix. Other early signs of labour can be increased Braxton Hicks. Now, you may be experiencing Braxton Hicks or not. We find they're much more common in second and third time pregnancies. Now, Braxton Hicks are really the uterus contracting, but what they're not doing is changing the shape of the cervix, not doing anything to the cervix. So I'm just going to demonstrate here with a balloon. So imagine this is the cervix, this is the uterus. If you're having proper contractions, those contractions will very gently move baby down into the pelvis and shorten the cervix. With a Braxton Hicks, actually all it's doing is contracting, but it's actually not changing the shape of the cervix. So if you can see the difference there, of course, you can see the cervix is shortening when we have those proper contractions. With a Braxton Hicks, nothing is changing. Now that doesn't mean that they don't feel like contractions, but what you'll probably notice is they're quite mild. They're also irregular in fashion. So, but towards our due date, what we can find is increased numbers of Braxton Hicks as baby's starting to engage into the pelvis, so it can kind of trigger those Braxton Hicks. If you do notice you're getting Braxton Hicks, do keep an eye on them. As I said a moment ago, they are generally irregular in fashion, but sometimes they can mimic contractions, and you might find that you get one every 10 minutes or so, and then they just suddenly stop. If they are Braxton Hicks, typically if you change position or have a glass of water, they go. Other early signs are things like sickness and diarrhea. So women can mention that they feel nausea when they are getting close to their due date. Nausea comes from all the hormonal changes. Diarrhea is also very common, and that's the body's way of just getting rid of everything to create space for baby's head in the pelvis. If you do notice you are feeling sick, if you are having diarrhea, just make sure you're drinking loads of water. Keep yourself hydrated. Other early signs, of course, are things like nesting. Now, we often laugh at women, pregnant women, for nesting, but nesting is actually an absolutely normal part of the process. We are mammals and we need to nest and create a safe environment for us to have our babies. Much like a cat would take themselves off into a dark wardrobe or space to have their babies, we need to do the same thing. So nesting is very normal and very common, and it's just part of us being mammals. We want to create a nice safe space for our babies to be born in. So don't laugh at your partner if she starts nesting, just let her get on with it. But at the same time, it is important to conserve energy. So if you are having big bursts of energy, that's also very normal, but also keep in mind that it's important to rest and be prepared for the labour journey ahead. Of course, other things you might notice are waters breaking. Now, we always think that the waters are going to go, we're going to have this big gush of waters and we need to rush off to the hospital like we see in every Hollywood movie. It's definitely not like that. We actually think that only around 10% of pregnancies start with the waters breaking. So it's actually very more common for your waters to break much further on in labour. In fact, some babies can be born still with the waters intact. So if your waters do go, it could be a gush, it could be a trickle, and that will be dependent on what set of waters have gone. If it's the hindwaters, it may just be a trickle. If it's the forewaters, it may be a gush. If you do notice your waters have gone, or you think your waters have gone, then check the colour. We want to make sure that they are relatively clear. They should be clear or maybe slightly yellow tinged. If you notice any brown in the water, then it's worth mentioning that to your midwife or contacting triage. That could suggest your baby has done a poo in the water, which is known as meconium. And that meconium can, in most cases, particularly if baby's gone past their due date, is nothing to worry about. It's very common for babies to do a poo in the waters, for their digestive systems to work basically before they're born if they've gone past a due date. But for very few babies, it can be a sign of distress, and it can also lead to something called meconium aspiration syndrome, where baby inhales the meconium and it coats their lungs and can cause problems with breathing. So it is worth just having that checked out. It shouldn't change your birth plan. They may just want you to come into hospital just to be monitored, just to check that baby is okay. So if your waters go, pop a pad on, keep an eye on how much water you're losing. Typically, if it's your waters, they won't stop. So, if you lie down, they might stop, but as soon as you stand up, you'll start to notice they're trickling again. But you can go into hospital to check to see if your waters have gone. They can do a very quick test to see whether or not it is waters, or, sorry to say it, in a lot of cases, it's actually just wee. Because by the time you get to that point of your pregnancy, it's hard to tell the difference between the two sometimes. Other early signs, backache. Backache can be a sign that things are starting to move along, particularly as lots of women say that the contractions started in their back. So if you notice you've got a bit of lower backache, it could well be the beginnings of labour. Put a hot compress on the back, have a nice warm bath and see if that makes a difference. And then of course contractions. Contractions are a very good sign that you're in labour, often starting off very mild, very far apart. You might notice them, but they're just kind of really easy, you're not really feeling much from them. The gap between them is nice and long. Eventually those contractions will start to get closer together, they'll become more intense, and that's a really good sign that things are starting to happen. And we'll talk about this in the course, but a really good sign to know whether or not you should think about heading to hospital is using either 3 in 10, so if you're getting 3 contractions in a 10-minute period, then that's a good indicator that things are starting to move to the right point where we go to hospital, if you're choosing to have a hospital birth, of course. Or 511 is also another good way of measuring it. So if your contractions are 5 minutes apart, they're lasting a minute, and that's been going on for 1 hour, that is also a good sign. What we're looking for with the contractions, though, it's not just the regularity of contraction, it's also that they are intense, that you're feeling the intensity of the contraction, and that's a really good positive sign. Remember, when you're having those contractions, what they're doing is just moving your baby down into the pelvis, which is where we want them to be, and shortening that cervix.